The broadcast is now starting. All attendees are in listen-only mode.
Thank you guys for coming here today. I think this is a very important topic. First of all, let's just talk about sex in general. I think it's always good to remember why most people consider this to be a sacred topic. It's not just about pleasure. Of course, sex is very pleasurable, but it's not just about pleasure. It's Emerson called Sex and Beauty the scaffolding of love. And many of the poets have talked about it being part of their creativity. Many of the inventors and entrepreneurs have credited much of their productivity to their sexual energy and their libido. But I think part of the reason you see it considered sacred is that not because it's written in sacred books, but because the way it's practiced has such a profound effect on what is considered sacred to us, which is our families. And I want to always remember that before we talk about the details of anything that has to do with sex. Partly because people are nervous about talking about it, even physicians, and without reminding ourselves of the importance of it, there's a tendency to either take it lightly or to be embarrassed when I think the importance of the topic demands that we have courage. So, along those same lines, a fairly recent article in the Green Journal or the Journal of Obstetrics and Gynecology, which is considered to be extremely reliable in this country, in a practice bulletin, showed that somewhere around 40% of women suffer with some sort of sexual dysfunction, either trouble with libido or arousal or pain or difficulty having an orgasm. And this is a very strict definition. This means that the women are actually distressed. So if a woman has decided that she can't become aroused, but she's happy living alone and it's not important to her anymore, then she's no longer counted as part of this statistic. And if you follow the recent meetings that took place with the Food and Drug Administration about our campaign to find more help for women who suffer with sexual dysfunction, you'll see part of the argument is that there are some groups who would argue that we should not even consider these suffering women as having a problem, that we're medicalizing their problems. But I think having seen over 10,000 patients over the past 25 plus years in my work with research with hormones, and having seen women come to me and cry and their husbands not know and their friends not know because they're embarrassed to talk about it, I think that having seen that is part of what made me obsessed. I admit it, I'm obsessed about finding help for couples who suffer because there isn't really a lot there. In this practice bulletin, there was only one Class A treatment for women, and it was short-term testosterone, other than therapy and lubrication. In other words, medical treatments, the only thing available is short-term testosterone. And even then, a woman who uses testosterone must use a man's dose. She must take a medication that was designed for a man. And for example, if it's a patch, she's got to slice it. Or if it's an injection, she has to alter the dose to where it's such a small amount, it's hard to measure. So this is important. And I think it's going to take courage on the part of physicians to keep pushing forward and pushing things forward. So, before I start talking about why I think genitals count, let me just talk about why they don't. Obviously, there's much more to the sexual response than the genitalia. And there's this whole female orgasm system, which I've tried to encourage people to use, because if we think in terms of systems analysis, you would never have, say, a pulmonologist say, oh, well, if we get the bronchial tubes dilated, they should be able to breathe well. Obviously, if you think of the whole system that involves breathing and involves alveoli and how blood and oxygen or how oxygen and CO2 exchanges across the blood barrier with the lung, and on, how all these things that have to do the way the diaphragm works, the way adrenaline affects the need to breathe fast or slow, or the metabolism, the acid base balance. There is so much involved with the respiratory system, same with the digestive system, that you would never hear someone talk about one part of that system and say, well, there's no use in respiratory dilators, bronchodilators. I tried that. It didn't help my breathing, so that's not a viable option. Obviously, if you think in terms of systems analysis, you understand that what works for one person may not work for another person. And yet, I see frequently someone talk about anything. Oh, therapy didn't help me, so that's bogus. Or this O shot. It didn't help my wife, so it must be bogus. Well, maybe your wife had a hormonal problem. Or my wife took testosterone, it didn't help her. Well, maybe it didn't help her because you're abusing your wife. Obviously, there's so much involved with sexual function. There's psychology, there's physiology, well, let's just talk about some of the other things. So here's just a few of the hormones that are involved. You have testosterone, free and total, thyroid function, prolactin, which can absolutely kill your sex drive, estrogen, which has less involved with sex drive but have some other emotions, and on the health of the vagina, all these different hormones. There are over 200 hormones made by the pituitary gland. Obviously, this is looking at even this profile is still a very primary look at hormonal analysis. For example, we know that when someone has a massage or they have breastfeeding, the oxytocin levels go up. So, and how that relates to sexuality, just that one thing is extremely elegant and complicated, and all of it a part of the female orgasm system. Relationships, the mental state at the time of the encounter, overall health. Women who are in better health, surprisingly, I'm being sarcastic, obviously, health underlies everything. You breathe better, you think better, you walk and talk better if you're healthy. And good sex is the cherry on top of good health. So women who have better health, as a general rule, can more easily orgasm. Not always. And actually, it's a little bit counterintuitive because there's a higher percentage of younger women who have sexual dysfunction. And one idea about why that may be the case is they're bothered by it more often because they're still trying to establish families. And so that could explain that. But if you just look at one age group and you control for everything else, overall health has a profound effect on a woman's sexuality. So it's not just about the genitalia, but can we please just admit that genitals are part of the equation and can be very important? It's a little bit disturbing to me when I see a therapist. And by the way, I recommend that everybody get educated better. Most people think they learned all they think they need to know about sex from the coach, men at least, from the coach who told them how to put on a condom in the 11th grade and how to keep from getting an STD. Oh, and then they learn more from their friends talking in the locker room and from watching porn. I hate to tell you this, but what looks good on the camera is not always what works best between two lovers. So most people are profoundly undereducated and they do not know what they do not know. And therapy and education is so very important, but it bothers me when I see therapists, not many of them, but some of them, criticize physicians who are trying to make genitalia better. You'd think that would be an open-minded group. Please, can we just say right now, genitals are important when it comes to sex? Now, one study showed in the Journal of Sexual Medicine showed that 33% of women who have a vaginal orgasm prefer a penis longer than 6 inches, while 60% of women had no preference. They were able to have wonderful orgasms with a penis 6 inches or smaller. And I choose that because what they gave the women to compare to was a bill, a piece of money that was 5.8 inches long. So they could say, would you have sex? They were in this particular study. They were talking to college women, and they tried to find, for this part of it, they isolated the women who had multiple partners, and they said, looking at this, would you have a better chance of having an orgasm if your partner's penis was longer than this bill, or does it matter? So, so obviously there's two different answers. And can we also admit that people are different? Not just men and women are different from each other, but 10 men might be different and 10 women might be different. So, what might be different about women who prefer a larger penis versus those who have no preference or who actually prefer a smaller penis? What is the difference? Well, let's talk about the anatomy. The clitoris has a shaft just like the penis, and most of that shaft is inside the body. So, one study fairly recently in the Journal of Sexual Medicine showed that women who have difficulty having an orgasm have a clitoris that's smaller and farther from the vaginal wall. So let's look at some pictures and let's look at the research that we're talking about here. So here is well, this is a really nice website about genital mismatch. We'll get to that. But here's the research about clitoral size. The Journal of Sexual Medicine is considered one of the most reliable, truly scientific journals about sex medicine in the world. And look at this conclusion. Women with anorgasmia, or inability to have an orgasm, possessed a smaller clitoral glands and clitoral components farther from the vaginal lumen, or the inside of the vagina, than women with a normal orgasmic function. So let's look at the anatomy and sort of think about why that might be the case. Go back up here and take a look at this. Well, here is a picture of the penis dissected out. And you can see it has three basic components: the glands and the corpus spongiosum and the corpus cavernosum. And you can see it splits into two different sections after it goes inside the man's body. And now let's look at a woman. Here is a woman's clitoris. So you have the glans clitoris, which is the part you're looking at, and just a tiny part of the shaft. And the inside, named by the same name as the penis, the corpus cavernosum, splits and sort of like scissors on each side of the vaginal lumen. So you can see if that were further away, it might be less stimulated. Some people postulate there really isn't a vaginal orgasm and a clitoral orgasm. What really happens is it's all a clitoral orgasm, because it's when a woman has an orgasm with penis or something inside the vagina, it's because this part of the clitoris is being stimulated. So while we're on the subject, what the heck is a G spot? Well, the G spot, according to Dr. G, or Dr. Grafenberg, was this brilliant Hebrew gynecologist who ran from Germany during Hitler's reign to seek refuge in the US. He thought the entire woman's body, if you read his original writings, was erotic. But he thought the most erotic and stimulating part of a woman's body was the urethra, and the G spot, named after him, was his reference to the fact that the part of this vaginal wall that is most sexually arousing to the woman when you press against it and stimulate the urethra, that is the G spot. So, anyway, that's the G spot. So, having sex with a clitoris far from the vaginal wall is like a man having sex and not able to stimulate the shaft of the penis. When you really get down to it, this labia is more like the man's scrotum. So, imagine a man trying to reach satisfaction in the bedroom if he could only have stimulation of the scrotum and the glands, but no stimulation of the shaft of the penis. He might he might be completely happy, but he might also be frustrated. So let's just say it again. Genitals do count in the sexual response, and it's much more elegant than just a particular size. It's not the size that matters, it's whether there's a fit. And so let's look at that idea by, I think, a fairly interesting and reliable. These are therapists that I think have a very well written book. And look at this, what they say here. This is not my idea. This is an idea that's been talked about since the Kama Sutras. It says, if a penis fits the vagina, it really doesn't matter how big it measures because, well, it fits. So, where sexual pleasure is concerned, the greatest pleasure is derived from intercourse with someone whose genitals physically match your own. So, if you feel sex could be better, you may need to find ways to make things fit better. So, you hear them talking about this mismatch idea. If you're mismatched anatomically, there are other things you can do. Obviously, you can change the angle, you can use the mouth, you can use fingers, you can use sex toys, you can do, that's where, even if there is a penis in the room, that's where lots of fun and experimentation and adventure can take place. And obviously, if you think about it, it's the fit that counts, but let's just think about this. There are people who have, there are couples where the man has, um, he's had prostate surgery, or there absolutely, actually, it's been shown that lesbian couples have more orgasms on the average than heterosexual couples. So obviously, there's no penis involved, and having a penis that fits a vagina is not the only thing, but it is a thing. And it can be an important thing to a couple where there's a man and a woman and they want to have stimulating, arousing, and satisfying sex with the penis inside her vagina. So let's look at some other ideas about that. Here's a really nice article about vaginal tears written by a group of physicians where they talk about this can happen from thinning of the vaginal wall, can happen from riding bicycles, which I don't recommend to men or women because it can cause sexual problems, and there can be a mismatch in genital size. I mean, really, do we really want to talk about this idea? Let's talk about the sutras. The Kama Sutras, brilliantly written. It's an old ancient Hindu, Indian um, piece of wisdom. And they talk about not only different size penises, which is called the hare, the bull, and the horse in the sutras, but you have different size vaginas. You have the deer, the mare, and the elephant. And it sounds kind of sounds sort of primary in our modern day. Do we really want to call some men horses and some bulls or elephants or whatever? But I mean, let's face it, there really is a different size. Here is the Durex triple XL, which comes 9.25 inches because some men have a penis that size. So you have a penis that size, and you have a woman who is a hare and the doe. If they're getting together, that's great. But if you have a mismatch in size, then that can be a problem. Well, the other thing that can happen is that people can start off matching and then they can develop a mismatch. The fit can change. Think about this. Men lose about 50% of the endothelium of the penis by age 60. Now, with the Priapus shot we're doing and with hormone replacement, with the Priapus shot, uh, we're injecting blood-derived growth factors into the penis, and we can restore some of this. Some brilliant research coming out of Paris now showing that can be done, and out of our own group of physicians here in the U.S. So the man's penis can shrink. Let's just say it. A man's penis can shrink with age. Women can experience childbirth. There are sexual practices that can cause enlargement. There's atrophy, and there's just simple aging, just like the man ages. So I don't say a man has a small penis. Even if it gets smaller, it may fit his lover better if she has a smaller vagina. A woman, you don't say a woman has a loose vagina. But she could have a vagina that is has a circumference larger than what she has when she was younger. And if she had a lover that in their youth they match perfectly, and now she's had a couple of children, so the circumference of her vaginal lumen is larger, and he has had aging with shrinkage of his penis, this couple that is now greatly fitting together emotionally because they've raised three babies and had a business that failed and succeeded, and now they're 50 years married and bonded in the soul, but now their genitals no longer match. So you can have a couple that fit perfectly that now no longer fits perfectly. So again, let me say this again. It's not just about the genitals. But if you can make things fit better, then why shouldn't you? I mean, there are therapists who specialize just in helping couples have amazing sex when the man has had prostate cancer. That's beautiful. But if we can make things better, why don't we? Why hasn't this? Well, partly because people don't like to talk about this. Research shows that only 14% of women ever have a conversation with their doctor about sex, even though somewhere close to half of them are having problems, and partly because the doctors avoid the subject. One study showed that even if the woman asks the question, the doctor will usually change the subject after he answers the first question. So there's not going to be, Miss Jones says, Dr. Jones, I'm having pain when I have intercourse. The doctor might ask one more question or answer that, and then he or she changes the subject. And that's been postulated. Part of that reason that may be happening is that the doctor didn't have a lot to offer. There's more to offer now. This is a really an exciting time because we do have much more to offer. Women avoid the subject because their friends criticize them. If you don't believe this, go on the blogs about the O-shot or about any sort of treatment for sexual dysfunction, and you'll see women criticizing other women as saying, well, you just need a lover who takes more time with you, or you need to use more lubrication, or you need to get somebody with a gold Visa card instead of a silver Visa card. And that's not me saying that. That's women saying that to other women. Almost every blog I read about sex, they criticize. It's almost like psychiatric disease. People comfort each other when they break their arm, but women who have schizophrenia or major depression, they don't tell their friends about it because it's embarrassing. It shouldn't be. It shouldn't be treated differently, but it is. Also, women are afraid to tell their partners. I've had women cry in my office many times and say, I'm afraid to tell my partner about this because I'm afraid I'm going to hurt his feelings. So they suffer in silence. And so part of the reason there hasn't been help for genital mismatch is of all the sexual subjects, sex in general is hard to talk about, but of all the sex subjects, probably the hardest to talk about is genital mismatch because women get offended if you talk about the vagina being too big. Now, but let's think about it. It can be too small too. Women have a hysterectomy. There are women, many thousands of women, that a penis more than 4 inches is going to hurt because they've had some sort of surgery for maybe they had cancer of the cervix and part of the vagina had to be removed, or maybe it's just their genetics, and a larger penis is going to hurt. So you can have and men, of course, get offended if you say their penis is too small. So, of all the subjects about sex, genital mismatch is probably the least, it's the most uncomfortable for people to discuss. So, but if the woman happens to have the courage to bring it up, the physician may offer surgery to help bring things back to the way they were when she was younger so that she now matches her lover's penis again. So, and again, I can hear the comments. Well, why should she try to match her lover's penis? maybe she loves this guy. We try to match personality types. We have some of us prefer a more studious person, some of us prefer a more party person, some of us want a dependent person, some of us want a very independent person. Can we not also have a preference in, do we want tall, what color hair, what color eyes? Can we talk? Maybe people might have preference for genitalia as well. So, um, what else can be done for mismatch? Not a lot. Surgery for the men can cause problems with erectile dysfunction and scarring. Surgery for women can be very successful, but it's surgery, and some women are not ready to have surgery. There are creams. You can use lubrication. Yes, lubrication. And I see this comment a lot from the sex therapists. Oh, buy a vibrator and lubrication. Well, can we please advance the science a little further? We've had lubrication and vibrators for 100 years. Can we think of something new? Women, those 40% of women who are still suffering, I promise you, most of them have been to the drugstore and bought a tube of KY jelly, and they've bought a vibrator, even if they had to sneak it home. And if lubrication and vibrators would make everybody well, we wouldn't still have 40% of women suffering. So let's think of something better. Hormone correction. Not saying there's not a place for those things. There's a huge, important place for those things. But let's add to our repertoire of what we can do to help people bond with this sacred thing called sexual function. Hormone creams, they do improve the health. They can help with pain. They can restore function, but they don't do a lot to help with genital mismatch. So they don't change the size of things very much. So why did I become involved? I mean, who the heck am I and why am I even talking about this? Well, I was involved in hormone research way back before it was cool, and back in late 90s and early 2000, before Suzanne Summers wrote her first book. As a matter of fact, if you go read the first book that she wrote, I did a review of that book on Amazon, and you'll see it still sitting there, at least as of now, because I was so grateful someone finally talked about something I'd been researching for years, and it wasn't as widely known. So part of the reason I got involved with this is when this thing came out about using platelet-rich plasma, which has been used for years in orthopedic literature. Let's go look at this for a second. Here was the first idea I had, but it wasn't my idea to use platelet-rich plasma. We make this very clear. Platelet-rich plasma has been used by dentists. It's basically a way of isolating the blood. And you can look here. There's there's a video. Well, I don't see it. Here we go. If you go to this Wikipedia article, you'll see it talk about centrifuges and how it's done. You can go look at that later. But basically, you're isolating the platelets from the bloodstream and creating an artificial scab. Think about when you were a child and you scuffed and scraped your knee as a child, that yellow goo around the scab. That was filled with fertilizer for the stem cells embedded in your skin and caused you to grow new tissue over that wound. That's what platelet-rich plasma is. So the dentists and the orthopedic surgeons have used it to heal wounds for many years. All I did was come up with a way. I didn't invent the centrifuges, to combine it with Juvederm to do some things with the face. But what most people don't know is that from the first time I picked up a tube of blood and used it in a centrifuge to create this stuff, I was thinking about how to use it for sexual function. Initially, actually, for the male, because I'm a male. So I admit I was thinking, what could we do to make men better? But then when I realized, and so, well, let me back up a second. So after doing this for a few months, I saw that you really could see new tissue form. You could see new blood flow. You could see all these changes that proved that you really were seeing what you'll see if you look at this research, that injecting platelet-rich plasma into skin, and here's a video of me reviewing the literature, it has a healing effect, and you get new blood flow, new sensation, new collagen, and new tissue formation. So you get a younger tissue. It's not a filler, it's actually a younger tissue. But I came up with a way to combine it with a filler and call it the vampire facelift. But really, the whole time I was doing this, I was trying to figure out how to make sex better because of my history with researching that. So eventually, I did use it in the penis, and then later in the vagina, it came up with this procedure called the O shot. So if you go, here's our little Facebook page about the O shot. And here, this is the video. I mean, this is the website about it. And you'll see it's been Cosmo, it's been in Tatler, it's been all over the news in different TV channels, Fox News and the Doctor's Show and lots of different things. But if you look at this research we did right here, you'll see that when we inject that platelet-rich plasma into the vaginal wall, let's see if I can make this bigger, that you see, and this was the first study, we have others that are coming out, you actually see an improvement in desire and arousal and lubrication and orgasm, but this isn't many thousands of people, so we're trying to duplicate this now with more research, and others are around the world, but that's the O shot. But again, even with this rejuvenation, the primary reason was to help with dyspareunia or painful intercourse and rejuvenate the tissue. But now, having doctors in multiple countries and over 10,000 procedures, what we know is some women will say they perceive their lover's penis to be larger just with the O shot, just injecting platelet plasma into the vagina. They perceive their lover's penis to be larger. So, but not all of them. And some women with genital mismatch, even though they got these results, increased circulation, decreased pain, it helps with incontinence, and improved the ability to orgasm, even though they saw those results, some with genital mismatch were still having problems. So this is why many of the providers have started offering LEO or laser enhanced O shot. Again, for years, we can take the research that we know from years of research with rejuvenating tissue on other parts of the body, and it applies perfectly to the vagina. And we know that a light laser treatment of the face, and then you apply platelet rich plasma on top of that to enhance the healing, and you get a tightening and a rejuvenation of the tissue. So what we're doing now is combining those two therapies. So we start off first with the laser. Let me show you what that looks like. So this is what it looks like. A little probe goes in, and then it only goes 400 microns. This is a new laser that's just become available in the US in the past year or so. It goes 400 microns. That means that it would go through a piece of paper, but would not go through a business card. And I've actually tested this. It's very shallow, but even that shallow amount is enough to cause tightening. So what some of the providers are doing now with this LEO is they're first doing that procedure with that laser tightening, and there's no pain. And the reason there's no pain is because there's almost no sensation in the vagina. The sensation from the vagina comes from the vaginal wall being stretched and then having friction or pressure against the urethra and the inside of the clitoris. So if you can make the vagina a little bit smaller, it brings those structures closer to whatever's inside the vagina. So LEO, you first use that laser treatment we just saw, then that's followed by the O shot. And with the O shot, we take the platelet-rich plasma. Let's see if I can find a picture of the. Here we go. That's the penis. Let's get a picture of the vagina. Yeah, this might be it. Yep. Let me just pull it up here. Vagina anatomy. Here we go. So first, we take and inject that platelet-rich plasma in this space between the urethra and the vaginal wall, right here, called the O spot, up close. And up here, close to the opening, there's also these glands called the Skene's glands, or the periurethral glands. And listen to this, they actually secrete a fluid that's like what exactly like chemically what comes out of the prostate gland of a male. So in women who ejaculate, that's where the fluid's coming from. It's a real phenomenon. It's a proven real phenomenon. If your physician's still telling you that female ejaculation is a myth, your physician should go read some of the recent literature, because it's not a myth. And it's coming from, just like the man's prostate gland secretes fluid when he ejaculates, the woman's Skene's glands or periurethral glands do the same thing. So injecting platelet-rich plasma first in this area between the urethra and the vaginal wall, it rejuvenates the tissue, new blood flow, new nerve tissue, enhancement of the Skene's glands, and you see women improve dramatically. Then the fluid also goes into the clitoris, injecting platelet-rich plasma into the clitoris, and which obviously comes down on each side of the vagina, as we just discussed, so that now, find that picture right here. So here's a picture of that. So injecting platelet-rich plasma here, it travels down into this area because it does act like a sponge and just travels like a wick of a sponge and rejuvenates that. But for someone who has this mismatch, that's followed by, with Leo, a laser treatment. So laser first, then the O shot, and it's followed by another laser treatment in 6 weeks. You don't do the O shot first because the laser would denature. It's like frying an egg. The proteins that are in the platelet-rich plasma would be destroyed by the heat. But you put the heat here first, have the tightening, you put the platelet-rich plasma as an injection, and you can also put it topically as a little douche there in the office. And it coats the area, it heals both the inside and the outside on the surface of the vaginal mucosa from the platelet-rich plasma. Repeat the laser in 6 weeks, and you repeat again in 12 weeks, and the combination is absolutely amazing. So who would not want this, Leo? There are women this should not be done on. If a woman has a smaller vagina, she could have the O shot done to help with the pain and help her use dilators. Let me show you what dilators look like, because it's if someone's claimed that, oh yeah, here's dilators. These are used to help, as the name implies, dilate the vagina. So if someone says, oh, sexual practices do not change the size of the vagina, well, of course they do. If a woman is doing something that does the equivalent of using a dilator every day as part of her sexual practice, it's going to change the size of it. But these were designed to help women who have a smaller vagina to more comfortably accommodate something larger. Accommodate, see, that's insulting. That word is insulting. It's like she's doing this just for her lover's pleasure. No, she's doing it for her pleasure too, so that she can be with the person she loves. Or if she has a very small vagina because of sex or something, there aren't many people that are going to fit. So using this dilator would allow her to more comfortably accommodate most men who are going to have something that's more like that. So it's so uncomfortable. It can be so insulting to think about genital mismatch, and people don't want to talk about it, but it's a real thing. And now we have ways to help. So if a woman has a smaller vagina, she's not going to want to get the Leo because she doesn't want something that's going to make it even smaller. She would want to use the O shot and combine that with dilators so she gets healthier tissue at the same time she's increasing the diameter of the lumen. If a woman has a larger vagina than what would fit her lover, notice I didn't say loose, I didn't say small man or loose woman, I said making them fit. Let's just get over acting like little kids. Who's got the biggest or the smallest? Whose big brother is the biggest? Let's talk about who fits together, so that we can have stronger families and relationships and get over our pride and talk about fitting with the one we love. So if a man has a smaller penis, or if he's lost endothelium, he should get the Priapus shot. Let's look at that. It's the same thing. We inject platelet-rich plasma. Priapus is just a synonym for penis. That's the Greek god of fertility. But the Priapus shot is injecting platelet-rich plasma. Remember, by the way, they used to say that men with sexual dysfunction, it was mostly from psychological causes. It's hard to believe now in the days of Viagra. But doctors used to tell men that 85% of men with erectile dysfunction, it was from psychological causes, and they advise urologists to learn how to counsel men about how to psych themselves out to have a better erection. Bull. And now we know it's bull. And now that there's Viagra and Cialis and all these other treatments, we call it bull. But you still have women, they might not be told outright that it's all in their head, but it's implied. It's not always all in their head. Sometimes it's in their vagina. Anyway, so if you have a man with a smaller penis, small as in doesn't fit his lover of choice, then he can have platelet-rich plasma and combine it with a penis pump. And about 60% of the time, we're seeing it enlarge. Now, if you make the man's penis a half an inch larger in circumference, and you make the woman's vagina a little bit smaller in circumference, the net effect is dramatic. And I have cried in my office along with my nurse many times when I've seen couples come into my office and say, the word they use is we're rediscovering each other because their bodies have changed. They've been married 50 years. His penis got a little smaller, didn't work as well. Her vagina was atrophic, couldn't grasp his penis as well. And now she's a little smaller, he's a little bigger, and he's a little more firm. And now they're like newlyweds again, and they're rediscovering each other. So you wouldn't want to do Leo in a woman who has straight up dyspareunia. You want to just use the PR, you want to use the O shot, and then have her use dilators if she's smaller to get it larger. And what if people match perfectly? And the truth is, you take two healthy adults, and then she's going to have a vagina that feels best with a penis somewhere between 5 and 7 inches. And he's going to have a penis that's somewhere between 5 and 7 inches if they're mostly sort of from the average population. So, what about those cases? Do you do anything? Well, yeah, you could do, first of all, you can say it's okay to try to make things better. It's all right to try to make good better. We try to make our smart brain smarter. We try to make our fit body fitter. Can we make our sex that's good sexier? It's okay if it makes a deeper relationship and it keeps the relationship new, and the procedures are safe. So the O shot could improve alone, could make the sex better for the woman. If they match in size already, you may not want to do Leo. But if they're close, it could be that if you do Leo with her and you just do the shot with him and leave off the pump, or maybe you do the O shot with her but not Leo, and you do the plasma with the pump with him. You see, there's all these combinations, and I'll be posting a treatment grid guideline based upon those three different sizes you saw talked about by the sutras. Remember this kind of interesting stuff about the sutras? Where did it go? Here. Yeah, these three different sizes. So you can imagine there's a grid that I'll post to the website that has suggestions only about what might be done. Remember, always education better. It makes things better. Always therapy, understanding your lover makes things better. So I'm not saying this is some magical shot that is going to fix everything, but I am saying that genitals count, and genital mismatch is a real thing. So what do you do if you want to actually talk to someone about this? Leo providers and OSHOT providers can be found at this website. Let me show you where to go. You can either just type that straight in, or you can go to oshot.info, type oshot.info, and then go right there to it. And then if you look at the top, you'll see find provider. So right now they're not marked, but very soon we'll be putting a designation so you can tell who does Leo and who doesn't. But everybody in here, you can see we're in multiple countries, we're in all the states, or you can put your zip code in and you can find the person that just threw my zip code in. It does it automatically if you let it, and find someone to help you with genital mismatch. It's okay to get smarter. It's also okay to think about and talk about your genitals. It is sacred. You should be careful who you talk about. it with. And if you have a lover that's sensitive, then that's time to have a therapist be in the room with you. But it's not good to keep suffering in silence and let the relationship and this sacred thing called family suffer as well. I hope this has been helpful. We have an amazing group of physicians from multiple universities. We have research going on. Check this out. We have research going on with lichen sclerosis that is almost complete now, and we're seeing great benefit with this OSHOT technology. Lichen sclerosis is horrific. It's horrific, and there hasn't been a good treatment for it other than steroids. We have one of the premier scientists in the area doing that research with us. This is being financed by the providers of the OSHOT. And one other very, very important thing, this is not just a thing you go do. These physicians and nurse practitioners are committed. This is a group. You don't just go hang out a sign on your office and say, I'm in the Mayo Clinic. You're in the Mayo Clinic if you're in the Mayo Clinic. This is a group of physicians that may be at different clinics, but they are banded together, understand the technology, they're sharing notes with each other, and they have agreed to follow certain guidelines. If they don't follow good guidelines and good practices, they get kicked off the site. If you find someone advertising this procedure or advertising Leo who is not on this website, number one, they're breaking the law, because it would be like hanging up a McDonald's sign if you're not a McDonald's franchise. That's trying to steal someone else's reputation. This is a highly reputable group, and only the people in this group are allowed to use this name. If someone's using this name and they're not on this website, they're breaking the law. They may be an amazing doctor, but you're taking your chances if you go see them. So, having said that, I'm honored you listened, that you are brave enough to talk and think about sexuality. We have both physicians and women and men on this call, lovers all, and I hope that you will share notes. There's a blog here on this website, on the OSHOT website. I'll show you where that is. Right here, reviews. I hope you'll share notes with each other, and that we will learn how to continually make more therapies available to keep our family strong. Thank you very much. You guys have a good night.